The podiatrist can do it as well, but I usually go through the dermatology people. Which insurance is she on?
Chips.
Oh, never mind. There is no dermatologist.
There's not.
Let me do this. I'm going to write you something called salicylic acid, which is just a really good irritant. Okay.
Yeah, that'll be good.
And put that on.
So could it pop?
No.
It can pop.
It's
very
hard. It's like a It's like a callus. So it's just hard, thick skin.
So should I get her
So cutting it off is a good idea.
Cutting it off's okay. And like I said, you can take a safety razor and just kind of shave the top layers off, and that's okay. You don't want to shave it down to the bone, obviously. You just want to kind of get the top layers that, because like I said, the skin's sitting there and it's sticking up just a little bit. You just want to get those top layers
I
off.
like cutting it off better.
Cutting it off a little bit, yeah. So use a pumice stone or something like that. But I've known people use toenail clippers and all kinds of stuff on them.
That's what she used.
Yeah.
But now let me ask you this. If she used the toenail clippers on that and then put them back up for somebody else to use.
Potentially. Yeah, you could go, hey, what's this bump on my finger?
Ew.
Well, especially if you're using a pumice stone on it. Only use it on your foot. You don't want to be using it on someone else's. Pumice stone, it's like one of those
It's like
lava
that yellow
rocks.
thing I have in the... You could use that every day in there. But only you. Don't let somebody else use it. And
Yeah, or else they could be
Pretty
getting
sure no
bumps.
one else uses it.
Yeah. So just make sure that it's, got your name on it or something. So,
wart infected. Don't touch
yeah.
it.
Dun, dun, dun.
So gross.
So lots of people get them. They will go away on their own eventually.
But
But
you have to
eventually it can be
irritate
a
it.
very long time, like months and years, if you don't irritate it. Duct tape's an irritant too. You can put a piece of duct tape on there. That'll irritate it. You can do Dr. Scholl's. They've got all kinds of wart remover medicine stuff. Try that. Start with the medicine with it.
Yeah,
Try
we'll
the
do that.
try the duct tape. Try if you want to try the over-the-counter freeze and stuff.
Okay.
If that isn't working, let me know and we'll do the salicylic acid. And if that doesn't work, we'll get one of the podiatrists to see it.
Okay. Now, let me ask you this. I know there's different kinds. That's not a plantar wart.
A plantar wart is one on the bottom of your foot. It's really considered a plantar wart because it is on the bottom of your foot.
But doesn't it have like little black spots?
Well, actually, this one does a little bit too, but that's just where it's bled into it, and it's like a little scabby inside there. And people call those seed warts and other things.
Yeah,
and so
yeah.
I've known people to kind of like pick those cores out. You're still not getting rid of the whole wart. So even if the core comes out, you still got to.
So the main thing is scraping it down.
Yep.
Because I remember when Zach was really, really little, he had a few on his chest.
He probably had soft warts called
He had
molluscum
something else.
contagiosum.
And you told him to just, like that, but
Yeah.
get like a little bit of sandpaper or something, and that would irritate it and make it go away.
Yeah. And so that was probably molluscum. And those are a little different. Hi.
Are you recording it?
No.
No, of course not. Wink, wink, nudge.
No.
So you're just scanning to.
Just look at the
That could be a
lighting. The
lawsuit
lighting in the
against you.
room. I wouldn't go to jail.
Not these days.
You might if you don't tell him.
So. Does it have a flash?
No.
I didn't even know you could record on those iPods.
It's a new one.
It's a new onesie.
So will they do video?
Yeah, no. It's no.
Wait, dude, are you lying or not?
I know, right? You just don't-
Hi.
So have fun solving
Hey,
this.
hey, hey. How do intestines get twisted?
Yeah.
Oh yeah, they wanted to ask
So
you that.
there's a couple of reasons. The most common thing is that you're born with them a little crooked.
No, because like one of my friends like last year, she got like her intestines tied up, and then she had surgery to get done, and they twisted up again. And she was gone for several months.
So she probably had a malrotation of her intestines to start with. And so
She's
before
a
you're
cheerleader.
born,
She's like,
everything starts kind of out on the inside and actually kind of twists a little bit as it kind of lays down in your stomach. And so she could have had a malrotation to start with. Either it didn't twist the 1.5 turns or whatever, I can't remember how many turns it's supposed to make to be complete, or it may have turned too far or not enough. And so it may have been that she was predisposed to that because of how things were set up. So the other thing though is sometimes you'll get big lymph nodes in your gut, and those lymph nodes will catch your intestines, and as they're kind of gliding by, it gets stuck, and that lymph node will kind of get sucked in, and it'll telescope across itself. And that's not really twisted intestines, that's something called an intussusception.
That's weird.
It's
Turn
usually
into
2 to
itself.
4 year olds, but you can get it in teenagers. You don't see it in teenagers very often.
Okay.
2 to 4 year olds.
And then we have another question. Are those like shots? Are those like an everyday?
Those are needles.
I want like needles. Are those like in like an everyday? Or like are those used?
Those are used, yes.
Okay. So it's like from an everyday, or you like clean it up like once a week?
They clean it out when it gets full.
Ew.
So it takes about, I don't know, 5 or 6 days for it to get full.
Okay, because we're wondering about just like a daily.
I usually see about 10 to 12 checkups a day. And some of those are 2-month-olds who are getting 4 shots. And some of those are 12-year-olds who are getting 2 or 3 shots. And some of them are 6-year-olds and 18-year-olds who aren't getting any. So it just kind of depends. Yeah, that's
Is Haley
medical
getting a
thing.
shot?
And then
You
don't you
should
guys
get
got people with warts and stick the
We do
shots?
actually they do. They'll sometimes inject yeast underneath it to
Yeah.
irritate it to make it go away. It's supposed to be pretty painful. The other thing they'll do is something called bleomycin, which is actually a chemotherapy agent they'll occasionally use, but that's kind of the last.
Would you lose hair?
No,
Oh,
it's
okay.
just local injection.
Okay.
Always the warts on
Yeah,
your
then it
head.
comes back as blue instead of red or pink or purple or anything. So. All right, anything else?
Let's
Okay,
see.
so irritated.
Okay, I can do that.
Rub it, scrub it, whatever. As soon as you get in the bathtub and it's kind of moist, rub it, get the thin layers off. Try duct tape or topical, the salicylic, you know, the
Maybe she could
over-the-counter
like
tape.
sleep with duct tape. And
Yeah. And then just take it off in the morning. So. And the duct tape isn't to peel the wart off, it's to irritate it because the adhesive is irritating to your skin.
Okay, so don't put it.
It may come off a little bit with it, but the whole point isn't to, you know,
Ew.
you're super gluing the wart, pulling the wart off that way. That's not how it works.
Oh. Okay.
How do you get warts?
Bad luck. You get the virus through your skin because you have a little cut or scratch or something like that. So you get it from the locker room or someone else's shoes or.
Really?
I only wore my shoes.
Yeah, but you could go to the locker
Yeah,
room or
but you
something
probably
else.
went barefoot in the locker room before you put your shoes on.
Everybody
Yeah, but
does.
you could have got barefoot at Six Flags theoretically. Not that you don't want to barefoot there.
Oh,
but-
goodness.
All right.
Okay,
If
sweet.
it doesn't work, let me know. And like I said, I get more tricks. So.
Okay,
Thank
So
you
we'll
so
see you
much.
later. You're welcome. Bye.
Bye.
Well, that was an interesting conversation.
Where did I get?
The stickers are up front. Is that what you're
Yes,
asking
I'm
about?
sure joking.
Bye.
Just turn it off. Are you seriously?
It's kind of. I think I got you asking if you could get leukemia.
What?
I think I got you asking if you could get leukemia from it.
Leukemia from what? They put it down.
Well, it's kind of fun.
Are these stickers?
Nope, it's lotion.
Oh, get some lotion.
What's that?
I need some lotion.
Me too. This thing is 7 minutes long. Look at the
Use
fish.
up all the space on your
I just put put them on not MySpace, YouTube. It's pretty funny. I don't know.
Haley, stop everything.
That's exactly what it's gonna be. So we learned about.
Still recording.
Yeah, actually I am. So we learned about warts, twisted intestines, kissing and shots, and then what?
Shots in a bucket.
Frogs in a bucket? Oh, shots in a bucket.
I don't know anything else.
Ass, I don't know.